In the fast-evolving world of primary care, staying updated with the latest procedures and best practices is not just a matter of professional pride, it's essential for delivering safe, effective, and compassionate care to every patient who walks through the door. Whether you're a seasoned physician, a resident just starting your journey, or a healthcare provider expanding your skill set, having a reliable, comprehensive resource can make all the difference. Few resources embody this blend of practicality and authority quite like Pfenninger Fowler's procedures for primary care. Imagine the day-to-day challenges of a primary care clinic. Each patient brings a unique story, a distinctive set of symptoms, and often an expectation that their provider can address a broad range of concerns right on the spot. From minor skin procedures and joint injections to women's health interventions and urgent care management, the scope is vast. The ability to perform procedures confidently not only elevates the standard of care, but also strengthens the bond of trust between provider and patient. This is where Pfenninger Fowler's procedures for primary care becomes an invaluable companion. The foundation of this book is its unparalleled clarity. Every procedure is broken down into logical, step-by-step instructions, making even complex tasks approachable. The authors understand that in the clinical setting, time is always of the essence. There's no room for ambiguity or guesswork. That's why each chapter is meticulously structured, starting with clear indications and contraindications, ensuring you know when and when not to proceed. This is followed by a concise review of the relevant anatomy and physiology, essential for understanding not just the how, but the why behind every step. But procedure, in medicine, is never just about mechanics. It's about patient safety, comfort, and informed consent. The book emphasizes these aspects with practical advice on patient communication, preparation, and aftercare. Each procedure includes tips for minimizing discomfort, managing anxiety, and fostering a sense of partnership with the patient. The authors bring decades of experience to the table, sharing strategies for troubleshooting common challenges and preventing complications before they arise. One of the defining strengths of Pfenninger Fowler's procedures for primary care is its visual approach. The book is filled with high-quality photographs, detailed illustrations, and diagrams that bring each procedure to life. For learners who benefit from seeing as well as reading, these visuals are indispensable. They provide a clear mental map of what to expect at each stage, from initial setup to final closure. Whether it's suturing a laceration, excising a skin lesion, or performing a joint aspiration, the images serve as both a guide and a reassurance. Beyond the technical details, the book recognizes the realities of modern primary care. Procedures are selected and presented with an eye toward what's most relevant and feasible in the office or clinic setting. This means a focus on interventions that can be safely and effectively performed by primary care providers, often with minimal equipment. The book also addresses the practical concerns of coding, billing, and documentation, ensuring that your work is not only clinically sound but also administratively robust. What truly sets this resource apart, however, is its adaptability. Medicine is never static, and neither is this book. The latest edition reflects the most recent advances in evidence-based practice, integrating new techniques, technologies, and safety protocols. It also responds to the evolving scope of primary care, including expanded sections on women's health, musculoskeletal interventions, and dermatologic procedures. The inclusion of updates on infection control, patient safety, and procedural innovations ensures that readers are always a step ahead. But perhaps the most compelling aspect of Pfenninger Fowler's procedures for primary care is its spirit. The book is not just a manual, it's a mentor. Every page reflects a deep respect for the art and science of medicine, for the privilege of being entrusted with a patient's care. It encourages providers to approach each procedure not as a rote task, but as an opportunity for learning, growth, and service. Consider for a moment the impact this kind of resource can have on your practice. Imagine approaching every procedure with the confidence that comes from thorough preparation. Picture the reassurance you can offer your patients, knowing that your techniques are grounded in the latest evidence and best practices. Envision the professional satisfaction of expanding your repertoire, being able to address a wider range of needs without unnecessary referrals or delays. And for those just beginning their journey in primary care, the book serves as a trusted coach, guiding you through your first procedures with patience and clarity. It demystifies the unknown, breaks down complex tasks into manageable steps, and instills habits of excellence that will serve you throughout your career. Even for the experienced practitioner, it's a tool for continuous improvement. Medicine is a lifelong learning process, and even familiar procedures benefit from a fresh look, a new tip, or a reminder of best practices. The book encourages this mindset, fostering a culture of reflection, openness, and striving for better care. In today's healthcare environment, patients expect more from their primary care providers. They want convenience, expertise, and a sense of security. By investing in your procedural skills, you not only meet these expectations, you exceed them. You become the kind of provider who can offer comprehensive, patient-centered care, who can manage a wide range of concerns efficiently and expertly. Ultimately, Pfenninger Fowler's Procedures for Primary Care is more than just a book. It's a bridge. It connects the classroom to the clinic, theory to practice, and provider to patient. It empowers you to make a tangible difference in the lives of those you serve, one procedure at a time. So whether you're suturing a wound, draining an abscess, inserting an IUD, or simply educating a patient about their options, you have at your fingertips the wisdom, guidance, and practical know-how to do it well. In a world where change is the only constant, having a resource you can trust is priceless. Embrace the opportunity to elevate your practice. Let Pfenninger Fowler's Procedures for Primary Care be your guide, your reference, and your inspiration on the journey to excellence in primary care. The difference you make will be felt not just in the outcomes you achieve, but in the confidence, trust, and care you bring to every patient encounter.